Hello, and welcome to Going Beyond Generics for RX Savings and the Power of Therapeutic Interchange in Finding Best Fit Medications for Your Members. Today, we are going to address real-world healthcare risks affecting all of us and discuss solutions for each of these risks in order to help build health plan and member resiliency. Resiliency is the ability to recover quickly from hardship. In a world full of unforeseen difficulties this year, to put it mildly, we want to focus on key solutions stemming from a powerful technology called therapeutic interchange. We are excited to be with you today to present important information about how using therapeutic interchange can not only lower medication costs, but significantly lower overall healthcare costs. We'll discuss how it can improve member engagement and elevate customer satisfaction, how your members can proactively control their medication spend with significant cost savings for your health plan, and much more. I'm Amanda Woodman, Sales Executive at Connecture DRX, and I'm here today with Arthur Tu, our Director of Product Management, and Janie Kim, our Director of Clinical Services of Connecture DRX. Their story and experience in this space will open up new doors for you as we share the impact of this exciting technology. So today we'll give you a brief overview of Connecture DRX and talk about what therapeutic interchange is and why experience and expertise in the pricing of drugs matters so much in the Medicare space. Then we will show you how therapeutic interchange tackles 5 real-world healthcare issues by demonstrating use cases and their supporting data. We're going to wrap up the session by showing how therapeutic interchange is an important tool in building resiliency and improving relationships with your partners and members during these uncertain times. If you have questions, please feel free to use the chat box to submit them. Connecture DRX has been around since 2000, and many of you might know us better as Destination RX. Destination RX became Connecture in 2002 with a focus on the under 65 market. In 2019, we shifted back to a sole focus on Medicare and added DRX back to our brand, so we are now known as Connecture DRX. We were purchased by Harris Computer Systems in 2019, which has been a very positive move for us in helping us develop our technology and expand our presence in the market. We are the market leader in Medicare shopping, quoting, enrollment, and retention. As a software company, we develop innovative solutions for health plans, provider-sponsored health plans, and FMOs, all with the goal of providing beneficiaries with their best fit Medicare plans and medications. We also provide network distribution for our customers in order to connect our health plan customers with the largest number of agencies and agents as possible, ensuring the most plan visibility. And we boast the largest Medicare distribution network in the industry because of the value it brings to our customers. Connecture DRX has a long history of expertise in the Medicare Part D pricing space. We currently provide drug pricing and transparency services to 95% of the Medicare Part D market. And to that end, we wanted to share that our extensive experience in drug pricing gives us a leg up in understanding how health plans need to respond in the market today. We talk about our gold standard pricing in the Medicare industry because it is the most accurate in the industry. And there are several reasons for this. One, we gather the most data directly from carriers, utilizing the same data they send to CMS for the Medicare.gov cost calculations. Two, our tools can price drugs down to the local pharmacy level. Three, our cost calculations take into account the most factors, including partial gaps, donut hole, preferred status, subsidy, and discount variances. And four, we also update our drug pricing data every 2 weeks. This information is important to setting the stage with what is going on in the world today as we look at the extraordinary cost of prescription medication and the ability for health plans to find the most effective, lower cost options for members with the goal of improving outcomes and lowering overall healthcare costs as members keep money in their own pockets. We know that if health plans can assist members in this way, members will have higher levels of customer satisfaction, which will prevent plan switching and improve member loyalty. Therapeutic interchange is a powerful solution to real-world healthcare problems. It is a technology you may not be too familiar with, so we want to share its power via data and case studies to demonstrate why it is so effective for health plans in lowering the overall healthcare costs, along with a multitude of other benefits. Today, we will discuss why it's important to go beyond just changing from brand name drugs to generics, how therapeutic interchange offers solutions in the face of drug shortages and recalls, the magnitude of potential savings using a real-world case study, how price transparency impacts prescribers and pharmacists and puts members more directly in control of their own health, and finally, how therapeutic interchange helps members improve medication adherence, which can ultimately improve health plan star ratings. Each of these areas has the power to better connect health plans to members, elevating electronic engagement, increasing member satisfaction, and ultimately building trust and brand loyalty. I'm going to turn the presentation over to Janie, and we'll dive into the power of therapeutic interchange.
Thanks, Amanda, and hello, everyone. Thank you so much for joining us today. Before we get to the real-world examples, I wanted to start by describing what therapeutic interchange is. According to the Academy of Managed Care Pharmacy, therapeutic interchange is defined as the practice of replacing with the prescribing physician's approval a prescription medication originally prescribed for a patient with a chemically different medication. In other words, it's when you take one drug and replace it with another drug that is comparable in its effectiveness. The power of therapeutic interchange can be incorporated into a member or prescribing-facing tool, an analytics engine, or a drug database to identify cost-saving strategies for health plans and members through the use of lower-cost drug options. It goes beyond replacing high-cost prescription medications with generic equivalents and can incorporate other comparable brand, generic, and over-the-counter medications. All therapeutic interchange programs should be evidence-based, meaning the rationale behind the programs should be based on clinical effectiveness research and other medical literature. This is important because there is usually more than one drug available to treat a particular condition. However, clinical evidence can further delineate and show which drugs can be interchanged for each other and under what circumstances it would be appropriate to do so. This is why extensive and ongoing research is necessary and vital. At ConnectYourDRX, we have one of the most comprehensive therapeutic interchange databases used by health plans and PBMs for over 20 years. You can see here the different types of references that can be used. Connector's database was created using all of these sources, including clinical studies, practice guidelines, as well as drug information sites and manufacturers' prescribing information. We also look at product recalls and the reasons behind them, whether they originate from the manufacturer or the FDA. We also use data from multiple drug data warehouses like Medispan and FDB. Currently, Connector's therapeutic interchange database has over 140 drugs with over 42,000 active NDCs. To illustrate the evidence-based research that is involved, I'll take a few minutes to share with you an overview of the process utilized at ConnectYourDRX, so you have a better understanding of why this is so valuable and to give you an idea of the enormity of work required to create a comprehensive database. All therapeutic classes are reviewed and maintained by pharmacists. Our pharmacists review a large amount of medical literature to identify which drugs and at which doses can be interchanged for different conditions. Then, board-certified physicians who are all practicing in their respective settings review what has been created to ensure it is consistent with current practice trends and what they see with their patients. After physician review, drug classes go through a database integration process. This is where the clinical research is merged and integrated with drug data elements such as NDC and package sizes to include in the database. Maintenance is the final step and is actually the most arduous step in the process. We have to ensure all the therapeutic interchange drug classes are continuously up to date with new drug approvals and discontinuations, as well as new practice guidelines, clinical studies, and safety notices. Now that I've given you a quick background on what therapeutic interchange is and how Connector develops and maintains our database, I'll turn the presentation over to Arthur to discuss ways health plans can use therapeutic interchange to go beyond generics.
Thanks, Janie, and hello, everyone. I'd like to start by briefly explaining the different types of therapeutic interchange options. The first are direct generics. A direct generic is a drug that is identical to the original brand drug in chemical composition and thus does not require a new prescription to make a switch. For example, Lipitor and atorvastatin have the same chemical composition, so a pharmacist can switch a member from the brand to the generic without needing to consult with a prescriber. Second are generic drug alternatives. These are lower cost medications that are generics but cannot be switched automatically. The prescriber must write a new prescription to authorize the switch. Third, we have preferred brands, which is a comparable brand drug and not a generic. These also require a new prescription from the physician. Finally, we have over-the-counter medications. Members can go from a prescribed drug to the OTC comparable option, removing the need for a new prescription. Often, members or prescribers are unaware that an OTC option is available. This is typically a more cost-effective option. One of the reasons we are talking about going beyond generics is because switching to the direct generic does not always have the best savings potential. To show you how this can be the case, ConnectYourDRX took a look at the formulary reference file maintained by CMS. This is a list of roughly 6,000 drugs available for Part D programs. Out of the 6,000 drugs, there are roughly 3,200 brands. Per the graph, of those 3,200 brand drugs, 62% had a therapeutic interchange option. This compares to only 40%, which had a direct generic option. That's over 700 additional doses in the therapeutic interchange database, presenting a wealth of opportunity going beyond just generics. To further illustrate this point, let's look at two examples where the direct generic is not the cheapest option available. Here, we averaged out the cost per unit for different brand and generic drugs using CMS retail pharmacy pricing. These costs represent what health plans are paying for these medications, a portion of which is then passed on to their members as copays or coinsurance. The average Medicare cost of EpiPen is $310 per unit. Its direct generic epinephrine is $161, a 20% savings. However, there's also a brand alternative called Syngepi at $133, a savings of over 57% off the brand. For another example, let's look at the ADHD drug Concerta, retailing at $390 per month for 30 tablets. The generic methylphenidate is $179 for a comparable dosage, a savings of over 54%. Sounds great, but there is also a therapeutic interchange option of generic Adderall, requiring 60 tablets a month, but costs only $38 per month at this quantity. That is a savings of over 90% off the original brand Concerta. These examples show how important visibility into therapeutic interchange options can be for health plans and their members. In switching from Concerta to generic Adderall, there is over $350 per month in savings, a significant cost reduction over time. In total, when looking at over 6,000 medications on the CMS FRF, we determined that roughly half had potential lower cost alternatives in the market. A little later on, we will look at a case study of the magnitude of potential savings, but first, I'm going to turn it back to Janie to discuss our next real-world scenario.
Thanks, Arthur. Now I want to show you an example of how therapeutic interchange can be used in the setting of drug shortages and recalls. In April of this year, the FDA announced an immediate market withdrawal of ranitidine drugs, more commonly known as Zantac, due to reported carcinogen contamination with NDMA. This was following months of voluntary recalls after trace amounts of the carcinogen were first reported in 2019. This recall affected millions of individuals who were taking the OTC drug, along with 15 million people on prescription strength Zantac. Health plan members with access to a drug comparison or therapeutic interchange tool can log online from any device and look for other drug options for Zantac. This puts the power into the hands of the member, who now armed with new information, can be proactive with their own health and take the initiative to talk to their physician or pharmacist about different alternatives. In our current situation of social distancing and avoidance of in-person settings, people might be afraid to walk into a pharmacy. In looking at an over-the-counter product such as Zantac, members can identify options, order the drug online, and even pick the medicine up through a pharmacy drive-through or have it shipped directly to their home. Some of the therapeutic interchange options for Zantac include Tagamet, Pepcid, and Axid. Interestingly, the Zantac shortage has led to people taking more Pepcid or its generic famotidine. And as a result, famotidine has also been added to the list of drug shortages by the FDA. As you can see, the world of therapeutic interchange is ever evolving and must stay current to support the needs of patients, prescribers, pharmacies, and health plans. As a result of COVID-19, Drug shortages are top of mind these days. It is creating a paradigm shift, helping pharmacists to become more resilient than ever. Pharmacists can send requests to prescribers and let them know if a medication is out of stock and initiate a change for a different therapeutic drug option. And now, new laws in certain states allow pharmacists to dispense other drug options without requiring a new prescription. A therapeutic interchange tool can empower pharmacists to navigate the member's formulary along with drug pricing information, enabling them to be more proactive with finding new drug options than ever before. Now, I'll turn it back to Arthur to discuss another real-world example.
Our next real-world situation focuses on high prescription costs and how to lower them. COVID-19 has dramatically changed healthcare delivery, and the economic impact of the virus on healthcare spending is still not fully known. The prices of almost 500 prescription drugs have risen this year, with an average increase of 5%. These prices started going up in January when the first cases of COVID-19 occurred in the United States and have not stopped. The graph to the right shows you the average price increases for the top 10 brand name drugs over the past dozen years, as compared to the overall inflation rate according to the Bureau of Labor Statistics. According to JAMA, prescription drug prices rose 3 times faster than inflation over the last decade, even when discounts were taken into consideration. According to a recent Truven Health Analytics NPR Health poll, 67% of patients do not take their medications because they cannot afford them. Due to the economic impact of the pandemic, unemployment peaked in April at 14.7% and currently sits at a little over 10%. These are the highest levels since the Great Depression, even higher than the Great Recession about a decade ago. With rising drug prices and decreased consumer spending, we can anticipate that medication adherence is going to become more and more of an issue as people cannot afford their medications. This means lower cost therapeutic interchange options are going to be more important than ever in this difficult landscape. So now let's look beyond direct generics to see the potential magnitude of savings we are talking about. We ran an opportunity analysis on over 8.7 million prescriptions for CMS FR drugs over the past year. We put this claims data through our analytics engine and evaluated the estimated cost and potential savings amount by therapeutic class. The potential savings here are available to health plans as members switch from higher cost to lower cost drugs. The 8.7 million prescriptions added up to about $1.2 billion in overall spending. Of these, roughly 32% had a lower cost options in our database. If all these prescriptions were switched to lowest cost options, the savings would be 37% of the original overall spend, a savings of $219 million. If even just a fraction of these beneficiaries can be switched to lower cost drug options, the potential savings is significant. Digging a little farther, we can see that roughly 2/3 of the savings are made up by the following 10 categories. There's a lot of information here, but I want to just drill down into 2 specific examples that help make up these numbers. First, let's look at diabetes. As we know, diabetes is a big problem in this country. Over 34 million people in the United States suffer from this condition. Insulin prices, meanwhile, continue to go up and have tripled in the past 10 years. Looking more closely at the category, we have one example, Novolog, of which 550,000 units were prescribed in our case study at $30 per unit. A comparable brand is Admelog, which comes in at an average of $13 per unit. In our case, if our case study health plan is able to get all their members to switch from Novolog to Admelog, they would see a savings of over $9.3 million in retail costs a year. Here, we can see the potential power of how a simple $17 per unit savings can add up quickly when matched with a commonly prescribed drug. Now, let's look at rheumatoid arthritis. Rheumatoid arthritis is a costly condition requiring consistent aggressive treatment for many years to control symptoms, manage pain, and stop disease progression. Rheumatoid arthritis is estimated to cost $19 billion a year in the US, with many patients paying up to $30,000 annually for their medication costs alone. Those with insurance can still end up paying 30% or more of the total cost of certain medications. If we look at the specific drugs in the rheumatoid arthritis category, we can see the following. Humira was prescribed in our claims study about 21,000 times at an average cost per unit of $2,600. When comparing Humira to other drugs in the rheumatoid arthritis category and taking into account efficacy, we find that Cimzia, which, while costing $4,400 per unit, requires half the dosing of Humira. This means that switching all 21,000 units for Humira to Cimzia resulted in a savings of over $8.4 million for our case study. This highlights the importance of having accurate dose-to-dose ratio information, since Cimzia, while costing more per unit than Humira, is still more cost-effective since members will be taking less of it. Finally, we did a breakdown of what type of switches were most common and beneficial in our case study. In looking at the chart below, we can see that switching members from a brand to a generic, or from a brand to a lower cost brand, gave us the greatest savings potential at over $7 million for each category. Going from generic to another generic had over $48 million in potential savings, largely due to the high volume of units prescribed for these lower cost drugs. Finally, it is only in a few instances where the direct generic was the lowest cost alternative, and these accounted for roughly $17 million in potential savings. In summary, we can see how much power there is to make a difference in the financial outcomes of both members and health plans by bringing therapeutic interchange analytics into play. And while individual results will vary based on a health plan's own negotiated pricing and preferred drugs list, the overall process and magnitude of potential savings should remain consistent. Next, let's talk about ways we can try to realize that savings potential by using therapeutic interchange system to bring greater price transparency on drug costs and comparable treatments to the healthcare market. Now we move on to our fourth topic, and how price transparency can help us realize our savings potential. People generally don't pick the lowest cost drugs simply because they do not know what their options are. From prescriber to pharmacist to member to health plan, price transparency around medications and their alternatives continues to be a gap we face in the healthcare market. Let's take a look at some potential points of interaction where we can introduce therapeutic interchange technology to make a difference. First, we will start with the prescriber. Being at the front of the prescription chain, the doctor's office is the ideal place to introduce price transparency and to put the member on the right fit prescription. This helps patients from having to do costly callbacks to the doctor, saving everyone time and money. With the increasing adoption of e-prescribing in electronic health records in physician offices, there's never been a better time to get therapeutic interchange options into the hands of the provider. Being able to see the estimated cost for prescribed medication, along with a list of potential options, would be hugely beneficial for physicians, as it would save them time from costly callbacks and help improve their patients' adherence to the prescribed regimen. As healthcare integration continues to advance and prescribers become ever more aware of saving opportunities for their patients, having price transparency to therapeutic interchange options will become more and more critical to the daily operations of the doctor's office. While standalone integration with existing e-prescribing and EHR systems would be ideal, due to the complexity of the systems involved, this could be a time-consuming process, slowing down adoption. In lieu of that integration, standalone sites can help bridge the gap, getting physicians the information they need from a reliable source. ConnectShareDRx's Drug Compare Suite is an example of such a source, providing cost transparency and therapeutic interchange data to a multitude of users. On the slide, you can see a screenshot of one instance of the Drug Compare tool. This technology can be used as a hosted site or made available via API and interface with the electronic tools doctors are using today. It is a great way for prescribers and members to confirm that the prescriptions they are starting on are the right fit medications for their plan. The next step in the prescription chain are the pharmacists. Price transparency helps empower pharmacists to be proactive care providers. They can help research pricing for members and be a bridge between the member and the physician. They are also usually the first to know when a member is trying to purchase a drug that is high cost or off formulary. But how do we get the therapeutic interchange data out into the pharmacies? Many PBMs today accept preferred alternative drug lists from their health plans. These are lists of high cost target drugs and their preferred alternatives specific to the carrier's formulary designs. When the pharmacist tries to adjudicate one of these target drugs for a member, the pharmacist systems can return the list of alternatives for them to recommend to that member. The pharmacist can take this information to the prescriber to get the prescription changed before the patient starts on their medication. With the therapeutic interchange system, ConnectShareDRx can take in a health plan's formulary and pricing data and use it to generate these preferred alternative files for PBMs in their specified format. We can take into account prior authorization restrictions in prioritizing the options to reduce unnecessary overhead, fewer calls and faxes. We can turn these files back over to the health plan's clinical team for review, quickly delivering thousands of lower cost options tailored to the plan's specific formulary. Finally, we can update these files regularly as new drugs appear and old drugs leave the market, saving clinical teams time and effort that can be used on other initiatives. In-pharmacy messaging is an excellent option for health plans looking to provide options for their members struggling with the sticker shock of high-cost medications. Big data analytics continues to be emerging technology in the healthcare space. While information is becoming more electronic, the tools for extracting, transforming, and interpreting that information lags behind in healthcare due to fragmented internal systems often acting in silos. Data security and HIPAA compliance rules, while critical for safeguarding personal health information, also presents a significant barrier in getting data science initiatives off the ground. The analytics engine powering the previous case study, or opportunity analysis, is an excellent tool for giving health plans visibility into their members' drug utilization and therapeutic interchange options. It runs off de-identified claim data, so no personal health information needs to be exchanged. For Part D plans, the analytics uses the same formulary and pricing information carriers already submit to CMS, or in many cases, already submit to Connect Your DRX for our plan shopping tools. If no plan pricing is available, the analysis can utilize cost information derived from the claims data itself to build pricing models for therapeutic interchange comparison. The end result is a detailed report highlighting key classes and medications that the health plan can target to receive the greatest savings on their investment. Once armed with the opportunity analysis data, health plans can then begin outreach programs to the members identified to be on high-cost medications. These outreach programs can communicate via email or text message or direct mail to inform members of how they can reduce the cost of their prescriptions with comparable efficacy. These communications can then encourage members to speak to their physicians about the alternatives listed or direct them to do research on a site like Drug Compare so they are fully aware of their options. While getting individuals to switch prescriptions can be a difficult process, if even a small portion of the targeted members make the switch, the saving gains, as we saw in the previous case study, can be substantial. Given the rising cost of medications and the current economic climate, presenting members with hundreds or potentially thousands of dollars in savings can be a key differentiator in medication adherence and member-carrier relationships. And now, let me pass it over to Janie, who will talk more about the importance of medication adherence and take us through star ratings.
Thanks, Arthur. So to end our webinar today, let's take a look at how therapeutic interchange can affect star ratings for health plans. Therapeutic interchange offers medication options that can significantly reduce costs and improve adherence to prescribed treatment regimens. According to a 2019 Kaiser Family Foundation report, many seniors stated having difficulties affording their medications and taking them as prescribed, and nearly 80% said their conditions worsened due to not taking their meds. The cost of medications has been shown to be one of the biggest barriers to adherence, if not the biggest. As studies have concluded time and time again, when drugs cost less, members are more apt to follow their prescribed treatments, which leads to better health outcomes. And as we all know, unfilled prescriptions can also lead to an increased risk of patients going to the ER, along with the chance of costly hospital readmissions. So adherence to medications is very important because it shows a positive correlation to improved health outcomes. This importance is even reflected in CMS's star ratings. Out of the maximum 47 measures for 2020, 18 of them were related to medication management and adherence. In addition to this, there are 4 measures that are triple weighted. These are for diabetes, high blood pressure, high cholesterol, and SUPD, which is short for statin use in persons with diabetes. If you count these triple weighted measures, nearly 50% of the star rating measures relate to medication adherence. So why is this relevant? In determining star ratings, as stated before, medication-related measures influence 37.5 out of 75 star rating points, or 50% of a health plan's performance. The ability to improve star ratings can also impact the financial incentives a plan can receive. One of the best ways to increase star ratings is to address medication adherence. Navigant Health conducted a study in 2018 which showed MA plans that are able to improve their star rating from 3 to 4 stars can see revenue increases of 13 to over 17% through increased enrollment revenue and additional QBP bonus payments. MA plans that are currently rated 4 and 5 stars receive an approximate $500 per member per year from CMS, which for a 10,000 member plan can equate to $5 million or $25 million for a 50,000 member plan. According to CMS, in 2020, approximately 48% of MAPD plans were still rated with less than 4 stars and not yet eligible for these incentives. By focusing efforts on these medication adherence measures, MAPD plans can maintain or increase their star ratings, which not only translates to healthier outcomes for their members, but also provides additional financial incentives to the plan as well. At Connect Your DRX, our therapeutic interchange database, combined with our repository of prescription drug costs, can be used to help identify plan members eligible for MTM programs, as well as provide a tool for healthcare professionals to proactively engage members and employ interventions related to these STAR measures. And now, back to Amanda to wrap things up. Amanda?
In these uncertain times, one thing will remain consistent, and that is your Medicare members will continue to look to you for guidance and assurance when it comes to their health and wellness. Therapeutic interchange is an approach which provides this assurance through lowering costs and improving adherence and outcomes. Going beyond generics and gaining visibility with a tool to engage at multiple points in the prescription life cycle is key in building resiliency in a healthy member population. At the end of the day, building resiliency between health plans and members in these uncertain times is all about finding not only the best fit Medicare or health plan, but also finding the best fit medication for members. In each of these areas we addressed today, going beyond generics, addressing drug shortages head on with therapeutic options, lowering drug costs, viewing these lower cost options earlier in the prescribing process, and improving medication adherence will all support health plans in improving their star ratings. Thank you for joining us today. We invite you to visit our website at connecture.com to learn more about our other solutions, including Plan Compare One, the digital Medicare for shopping, quoting, enrollment, and retention, our BrokerLink network and Database RX, and Drug Compare, which we discussed today. We also look forward to seeing you in our virtual booth and scheduling time to present demos on our technology. We welcome your questions.